here. Welcome everybody. My name is Gail Nixick with Elderwerks. And we're very pleased, and I'm going to do my very best because we have Alexandria Ungari.
Yes.
Oh my gosh. Who's been a Humana representative for the past 6.5 years. She's had the pleasure of helping many Medicare beneficiaries choose the right plan to their needs for their physical health as well as their financial health. Her favorite part about her career is able to educate and help those with Medicare feel safe and secure with the choice of health plan, all while having fun getting to know and work with them on a day-to-day basis. Aside from work, this is the important part, there are two lovely children, Vinny, who's almost 6 years old, and Giovanna, who's now 21 months old.
Oh, yes.
Wow, that's a handful.
She is.
Keeps you very busy and entertained. She loves to play outside on adventures no matter what the season. Now that's a positive person living in Chicago. Welcome so much. Thank you so much.
Thank you, and thank you so much for having me. All right. Are you guys ready to learn a little bit about Medicare today? Yeah? Yeah? Okay. Again, my name is Alexandria. I go by Alex for short. My card, my information is on the tables for you. Also on the table is this green little booklet. Basically, it's foldable, so it gets kind of large if you're sitting next to a neighbor. It kind of goes over everything I will go over today. It's broad information about Medicare. Okay, so I'm not going to go into any type of plan specifics or anything like that. I can't answer any of those questions today. I'm here to just strictly educate you about Medicare, your choices, and things like that. My job here is to make sure that you're more knowledgeable than when you came in, I guess, if you could say. And I also educate on Medicare throughout the year, as well as annual open enrollment is coming up in October. So every year between October 15th and December 7th, those who are entitled to Medicare get to pick and choose plans. But sometimes it's hard to know what's what with all of the new information out there, new plans, mail probably spewing in and out of your houses, phone calls, and things like that. So I'm kind of here to clear everything up. My job, again, is to have fun and educate you guys. I do like an open question type classroom. So if you guys have questions anytime throughout this, just raise your hand because chances are someone may have the same question. And we can just go over what that question is when we're talking about that specific subject, okay? All right, I have to do my clicker too. Here we go. Okay, so this kind of just talks to you about what my job is, okay? I part of my job too, besides educationals, is I do participate. I do work for Humana, and I do mostly in-home appointments or face-to-face appointments. So what that means is if you, after this, would like to make an appointment to learn more about Humana, besides just Medicare, you can make an appointment with me or a phone call, schedule a phone call, and I kind of help you every step of the way with guidance in what type of plan is best for you. Again, today we're going to cover your Medicare eligibility, okay? What exactly Medicare is, your Medicare options, important dates for you guys to remember and what's coming up, and choosing and how to choose a plan and what's what in regards to plans and what's out there. Okay, so this is the part Medicare. Okay, show of hands, however, you guys all have Medicare, and everyone Medicare eligible in this room or getting Medicare, know somebody on Medicare, right? That's why we're all here. Okay. So original Medicare. Original Medicare is that red, white, and blue card you guys may have already received or have been entitled to or may be getting ready to be entitled to. Medicare is provided by the federal government. Okay, it's one of the largest healthcare agencies, obviously, in the United States. And it is split up into 3 parts, okay? Your red, white, and blue card has your Medicare beneficiary ID number on it, with A and possibly or a B start date as well. The other part of Medicare is called Medicare Advantage, which is Medicare Part C. And then the third part of Medicare is Medicare Part D for prescription drug coverage only. Okay, so there's Medicare A and B, which is your red, white, and blue card. Medicare Part C, which is also known as Medicare Advantage. And Medicare Part D, which is prescription drug coverage. Does anybody have any questions about this specifically? No. Okay. Okay, so in regards to Medicare, the biggest question is, are you eligible for Medicare? So those who are Medicare eligible have 3 months before their 65th birthday, the month of their 65th birthday, and 3 months following their 65th birthday for your initial enrollment period. That's the time where you have Medicare A and B, you get your card in the mail, and you're ready to choose a Medicare plan. You also can be eligible for Medicare Part A and B if you are under 65 and have a qualifying disability or end-stage renal disease. Okay, does anybody have questions about this? No. Okay. So Medicare Parts A and B. Original Medicare helps is the key word, helps cover, but not all of your care. Okay, so on your red, white, and blue card, it has that Part A and the Part A start date. Okay, what does Part A help cover? Part A helps cover inpatient care in the hospital, okay, overnight hospital stays, skilled nursing facility care, and hospice care and home health care, okay? And Part B helps cover things like doctor's visits, other outpatient care, as well as durable medical equipment, some home health, and some preventative services. Okay, the most important thing to kind of take away from this is, again, Medicare Part A and B only help cover your medical out-of-pocket costs. So Medicare A and B cover 80% of your costs. Okay, leaving 20% kind of open-ended, and that's where agents like myself come into play and help you choose a Medicare plan that best fits your needs. Does anybody have questions about this? Okay. So what I'll first talk about is that 20%. Okay, so what can be put in place to kind of help cover the 20% that Medicare doesn't pay for? Okay. You have a couple of options. One of the main options would be to buy a Medicare supplemental insurance. Okay, so you may hear your friends or family talk about the G plan or the N plan, or I pay this amount a month for just my supplemental insurance. Because supplemental insurance typically only cover what Medicare doesn't cover medically. Okay. So you go to the doctor, you first show your red, white, and blue card, and then you show them your supplement card. They help pay some deductibles, okay, co-payments, co-insurance, and other costs that original Medicare doesn't cover. When you have a supplement plans do not they're not limited to a provider network. In other terms, if you show your Medicare card at a doctor that takes Medicare, they automatically take your supplemental insurance. Okay, so there is no networks with supplements. The bottom of this says, Medicare supplement is not the same as Medicare Advantage. Okay, supplements with a supplement plan, typically it does not come with dental coverage or vision coverage or hearing coverage or prescription drug coverage. Okay, when you purchase a supplement plan, you're only getting the medical coverage. Okay, so Medicare covers it first at the doctor, and your supplement pays the rest at the doctor's office. And when you shop for supplement plans, you're basically shopping by rate. Okay, what company is giving me rate for each letter that you're shopping for? So your other option would be to take a look at what's called a Medicare Advantage. So Medicare Advantage is not a supplemental insurance, obviously. It's just a different way to insure yourself. So basically, when you have Medicare Advantage, you're also enrolled in Medicare Part C, okay? So to kind of put it into terms where A and B, so Medicare A and B, also equals C, okay? And Medicare Advantage also includes, the majority of plans could include extra services that Medicare doesn't cover. Okay, so if you hear on TV or in ads, we cover dental, we cover vision, we cover hearing, there's extra benefits that you can get with our plan that original Medicare doesn't come with. That plan is more than likely a Medicare Part C or Medicare Advantage plan, okay? Usually, there could or could not, depending on the service area, there may or may not be premiums associated with these plans, okay? You will always remain a Medicare member, so you're not losing Medicare, okay? You have to continue to pay your Part B premium in order to qualify, okay? And these plans may, and some of them do not, but mostly these plans also come with prescription drug coverage. So you don't go out and buy a separate drug coverage plan because it automatically comes with your Medicare Advantage plan. So when I talk to my members, I basically describe Medicare Advantage as like your all-in-one, like an umbrella plan, right? You're looking for a single plan that covers, it's like your fast pass. I don't know if any of you have ever been to Disney World, but you get this fast pass and you can kind of show it everywhere and it gets you in everywhere. So that's kind of what Medicare Advantage plan is. You show the same card at the doctor, the hospital, the pharmacy, and then even places like your dentist's office, your optometrist, the audiologist, and things like that. Does anyone have any questions about this part? No. Okay. These plans typically also follow what's called a provider network. So when you are looking at a Medicare Advantage plan, the most important thing is to make sure or to check out which providers or what providers are in the network with the Medicare Advantage companies that you're looking at. When you're also shopping for Medicare Advantage, if you're in the market for Medicare Advantage, there's a couple of different types of plans that you're looking at, okay? Now we're breaking it down even more on the Medicare Advantage part. There's HMOs, which is Health Maintenance Organization. That's kind of like where your primary care provider is like your head coach, okay? And they are responsible for giving you referrals to certain specialists if or when it's needed, okay? And typically with an HMO, you're staying with that doctor group. For example, Amita is a popular provider out here, right? So if your primary care doctor is associated with Amita, on an HMO, they would refer you to Amita specialists and you would get your care and things done at the Amita hospital. That's an HMO. PPO is Preferred Provider Organization. So in a Medicare Advantage plan, you can use your PPO at any doctor that takes Medicare, okay? However, you may pay less for in-network doctors. So even with a PPO plan on Medicare, when you're shopping and you're looking at a PPO plan, it's also important to make sure your doctors take that plan if you want to save the most money. Does anyone have questions about that? No. Okay. And then private fee for service. So generally, there's more freedom to choose your doctors with a private fee for service. These aren't as popular anymore, but basically the doctor has to approve, he sees you on the terms of the billing situation and the arrangement. So he may or may not accept Humana at an individual provider basis. So any questions? Go ahead.
So a person's asking the relative cost of the different kind of plans, or some more or less expensive, the PPOs versus the HMOs?
So it just depends on the company, okay, the service area, okay, and then either, some HMOs have premiums, some HMOs don't. Some PPOs have a premium, okay, and some PPOs do not. A premium is your monthly amount that you pay for the policy, okay? So it honestly, when you're shopping, it just depends on how you want to navigate your health care. When you're looking at Advantage plans as well, and again, I can't go deep into specifics, but there are co-payments. So a co-payment is what you pay to the provider for this service, okay? And so, for example, the HMOs could have different co-payments for certain benefits and PPOs. So, part of my job, or, there are agents out there and agents like myself, we do, plan comparisons. So if you're somebody who's more concerned for your financial health, we'll take a look at, okay, what are the plans what plans cost and what in your area, okay? And what are the co-payments and out-of-pocket costs for certain things. Again, so it just depends on the plan that you're looking at. If you're someone who's more concerned about your physical health, so you'd rather pay more for a doctor that is in the network, well, then we would find a specific plan that takes your doctor and we would go from there. Okay, so moving on. So Medicare prescription drugs. Okay, so Medicare does not provide a drug plan. Okay, so Medicare gives you your medical and then they say, all right, you're on your own to find your drug plan. And if you don't, there could be a penalty if you do not have credible prescription drug coverage in Medicare's eyes. Okay, so it's really important to, even if you're not on any medications, it's still important to be enrolled in a Medicare prescription drug plan if needed. Basically, if you're not a veteran or if you don't have another source to get your prescriptions that's not credible for Medicare, it's very important to have Medicare prescription drug coverage. And there's two ways to get Medicare drug coverage. So one way is to get it with your Medicare Advantage plan. Okay, so you might see the letters MAPD, Medicare Advantage Prescription Drug Plan. That shows that it's an all-in-one plan. So you have drug coverage that comes with that certain policy. Now, when you are shopping, and let's say you're really interested in a Medicare Advantage plan, be aware that there are some plans out there that do not come with drug coverage. Okay, and typically those are geared towards veterans. So our veterans, if there are any veterans in the room, thank you for your service. And you get your prescriptions at the VA, then that is credible coverage in Medicare's eyes, and you could take a look at a Medicare Advantage only plan. And then the other way to get Medicare prescription drug coverage is to purchase a separate drug plan besides your supplement plan. Medicare drug plans are available from private insurance companies like Humana, and they require to provide a wide list of covered medications, okay? And a list of covered prescriptions may vary by plan. How many of you guys heard the term formulary? A lot of you. Okay. So what a formulary is, it's a list provided to you, okay, the Medicare beneficiary, of all the covered prescriptions on that plan. Now, most of them, if you are, visiting with an agent like myself, we provide what's called an abbreviated one, but there is the full list online, or you can request the full list by paper. And when you're shopping for a drug coverage plan, it's very important to take a look at the premium, okay? What prescriptions are covered under that specific plan, your deductible, and your co-payments for your prescriptions, right? So most of the time, not most of the time, all the time, there's 5 categories of prescription drugs. They fall into tier 1 through tier 5, okay? Tier 1 being your least expensive, and your tier 5 being a specialty prescription. And those often, and then the co-payments will vary on what tiers your prescriptions are falling under. Okay, someone has to have a question. Nobody? Okay. Following Medicare prescription drug coverage is called, how many of you, have heard of the donut hole? The donut hole, okay. also known as the coverage gap, the dreaded donut hole. The donut hole is a Medicare rule, okay? So whether you are shopping with Humana or Aetna or United or whoever that provides a Medicare drug plan, okay, has to follow this little chart right here, okay? There's 4 stages in your drug coverage, okay? Stage 1 is your deductible stage, okay? So a deductible is when you pay the full amount, right, before the insurance company pays their share of any costs of the prescriptions. Some plans, however, skip that stage entirely. They'll say you do not have a deductible for your prescription drugs on this plan. So right away, you're in what's called stage 2, where it's also known as the initial coverage stage, where you pay your copayment for your prescription, if any, and then companies like Humana will pay the rest or their share, and it's called basically splitting the costs, okay? If or when or until your total of what you've paid and what Humana has paid reaches $4,430, that's when you find yourself in the donut hole, okay? And that's when you start paying a little bit more for your prescriptions. This year, it was 25% of the cost of your generic and brand name drugs, okay? And what's happening is they're pooling what you're paying, what they're paying, some other things that you can take into consideration, like coupons or discounts from the drug company. And once your total reaches a $7,050 limit, then you fall into the catastrophic coverage stage, where you'll find that if you see on the chart, your costs go way down during this stage. Okay, does anyone have any questions about that? I know it's really confusing. It's probably the least fun part of my job to go over this, and I know how hard it can be with some prescriptions. But you know, it's a rule that every company has to follow. Go ahead.
What's the name under stage 3 and stage 4?
So that's coverage gap. So coverage gap, that term, it also means donut hole. And then stage 4 is catastrophic coverage. So that's like, okay, you've definitely met your limit. You've spent this much money out of pocket. We're finally going to give you a break. Yes.
So today with some of the medical advancements with doing chemo via pill,
Okay.
and some of the pills can be very expensive. How does that relate to these 4 stages?
So depending on when, there's a couple different things. It depends on when you get it filled. Okay. So if you come out of the gates in January and you get it filled right away, okay, you may get to stage 3 right away come January, because the cost is so high, right? So what happens with chemotherapy, like a pill, and it's part D, and it's not done through the medical side. Yes, you typically almost will always fall into stage 3, sometimes even stage 4. And most of the time, those types of pills are what's called specialty. So those are like the tier 5. And you're already on most drug plans, or depending on the drug plan that you are on, it's a percentage of the cost already. Okay, so there's really no copayment for tier 5s, but it could, again, vary. So you're automatically paying a percentage of what it costs. Then Humana is paying their portion, or the drug company you choose, okay? Typically, you're probably going to surpass a $750 limit, right? So then you would be in the catastrophic coverage stage. So in the catastrophic coverage stage, you'd probably the 5% of coinsurance, whichever is greater. So you're paying either $3.95, $9.85 for all other drugs, but then 5% of coinsurance, whichever is greater, and more times than not.
So for the expensive drugs, say if it's 10,000, if you exceeded stage 3, it's 7,000, and if the drug after that, if the drug costs say $1,000, then you're paying 5% of $1,000.
Yes, or whichever is, either $3.90, well, it's probably $9.85 or 5%, whatever is greater. Yes. Now, with those specialty drugs, there are programs and things like that. I would advise if somebody is in that position to talk to your insurance company or the pharmacist. Like Humana, for example, has a pharmacy, their own pharmacy, and we have pharmacists that answer the phone all the time. And they would kind of talk you through that. There's also different types of ways that you can go about getting an expensive prescription like that, like talking to your doctor to get a coupon, or actually reaching out to the manufacturer themselves, sometimes through their programs and things like that, even with private insurance, like a drug plan, they can help those with the cost of really expensive medications. So that was a good question. Does anybody else have any questions about this? No? Okay. Okay, so another plan would also be what's called a special needs plan. Okay, so special needs, you have to have original Medicare, okay, and have at least one of the following. So if you're somebody with a specific eligible chronic condition, such as diabetes, heart disease, and chronic lung disorder, you may qualify for a special needs plan. If you have Medicaid assistance from the state, you may qualify for a special needs plan. If you have a need or an expectation of a sudden long-term care for nursing or skilled nursing facility, or even an intermediate facility, there are plans out there that specifically help those in these categories. And what that is called a Medicare special needs plan, and it's focused on benefits to meet the needs of these, and specifically in these categories, as well as a skilled nursing home. Okay, does anyone have any questions about that? Go ahead.
Is asthma considered a chronic lung disorder, or does it have to be something like COPD?
On each plan, when you are enrolling in that plan, there is a list of questions for the agent to submit, or for you to submit if you're doing it online, and that could be plan specific. Okay. But if it's diagnosed, I think it has to be diagnosed a chronic lung disorder. So it would be kind of a gray area or something more clinical for the doctor to get involved to qualify for that. Mm-hmm. Any questions? Okay, yeah, I'm sorry, I have to skip around. I don't know why I was reviewing this and they kind of made it out of order, so I'm making it in my own order. On how I usually talk to my members, I'm like, I was reading it last night, I'm like, this doesn't make sense for me, so it's not going to make sense for them. Okay, so again, going over what your Medicare options are. Some people that I meet are happy with just what I call straight Medicare, so original Medicare, and they only carry their Medicare red, white, and blue card around. Again, if you do that, you are responsible for 20% of out-of-pocket costs that come your way, okay? There's also, I don't know if you guys knew this, but there's also deductibles that come with A and B that typically a supplement plan or a Medicare Advantage plan help cover, okay? The deductible for Part A in 2022 is around $1,500, and the deductible for Part B is $233. So if you just have your red, white, and blue card, you have to pay that amount first, and then Medicare will cover 80% of your out-of-pocket costs. If you're choosing original Medicare with a prescription drug plan, again, your medical out-of-pocket costs would be the same as what I previously explained. And then you would have a separate drug coverage card that you would show at the pharmacy, and that would help pay for your drugs specifically. They keep fighting us with that door. Original Medicare plus a supplement. So if you have original Medicare, okay, then you have a supplement card. You're presenting two cards at the doctor, your red, white, and blue card, and then your supplement card. And then you have another card for your drug coverage, okay? Keep in mind, too, that's 3 separate premiums. So you're paying your Part B premium out of your Social Security check typically. If you're not collecting Social Security, you're typically paying that by quarter. Then you pay a premium for your Medicare supplement plan. Okay, and again, depending on the company, the service area, your age, all premiums for supplements are different for everybody. And then your prescription drug plan, okay, is a separate premium. And again, typically the supplement and the drug coverage part, if this is the route that you choose, if you wanted additional dental, hearing, vision, over-the-counter, silver sneakers, those are things that you'd have to purchase separately. Okay. And then Medicare Advantage. So Medicare Advantage is your A and your B. And typically, in most cases, your Part D in an all-in-one umbrella plan. Okay. And that typically includes the dental, vision, hearing, and things like that. Okay. And each plan has different benefits that come with it. So if you're shopping for a Medicare Advantage plan and you're interested in the dental and vision and hearing portion as well, those also vary by plan. So you have a lot of choices. If you are already in Medicare and you want to enroll in a Medicare Advantage plan or change your Medicare Advantage plan, there's an option. There's a couple different options for you to do that. If you're enrolling in Medicare and for the first time, again, that's your initial enrollment period, that 7-month window we went over before. Medicare also has what's called the annual election period. Again, October 15th through December 7th. You have about 10 weeks to take a look at your plan, maybe what you're paying now versus what's out there. Okay, what other benefits could be included in different companies. As well as it's also a time to change your prescription drug plan too, if that's one of your concerns. Okay, it's October 15th through December 7th. Other enrollment periods. So there's one called Medicare Advantage Open Enrollment. So it's different than annual. Open enrollment is from January 1st to March 31st of each year. And this is if you are a current Medicare Advantage member, okay, and you're not happy with your plan or the service, and you want to switch out of that Medicare Advantage plan into a new Medicare Advantage plan from a different carrier or a different type, you can do so during that time, January 1st through March 31st. And then special enrollment period, that is when you can change your Medicare Advantage plan throughout the year with a special life event or circumstances like moving or a plan leaving your service area, or if you have other qualifying factors. If you're dual eligible, meaning you have both Medicare and Medicaid or extra help. If you or your loved one or someone is losing employer coverage, that's also a time to disenroll from your employer plan if you have Medicare A and B and you want to choose a Medicare plan. And then there's a couple other type of special election periods that if you call an agent like myself, they would be able to educate you on that as well. This is just a little slide. So basically it talks, explains everything I've kind of went over. So when you're looking at a plan, there's things to consider like your financial health, your physical well-being, the benefits that come with the plan, convenience. Okay. Who are the providers? Are my providers accepting the plan? If your providers are accepting the plan, that's great. Then you don't have to change your line of care. The needs. So again, important. The medications you're taking, or maybe you're not taking anymore. Maybe you're not happy with your current doctor and you'd like a plan that kind of help facilitate that. Maybe you'd like to add good dental coverage or good vision coverage. Or if you're interested in saving money on a hefty premium that you've been paying every month, there are plans that there could be in your service area that don't have a premium, okay? So these are all things to take into consideration if you're considering changing plans or looking at what's out there that's best for you. These are kind of like the 5 core things that we go over in an individual appointment to make sure that the plan that you have best fits your needs. Also helpful resources besides like an agent like myself, Medicare.gov, or there could be a SHIP counselor as well. Medicare new handbook, take a look at for those in the mail. That's probably going to be coming soon for 2023, as well as floods of postcards and things like that from different Medicare insurance companies. And the SHIP counselor, so there could be a SHIP counselor at your local Social Security office. Go ahead.
Say vision, because vision is important for you.
Mm-hmm.
Do you offer like a VSP plan separate from Advantage, or do you have to be part of an Advantage?
Humana specifically does offer both. So we did there, you could buy an additional vision if you are on a supplement, but you would just like to take a vision plan out, you could do so.
A VSP, okay.
Yes.
How much would that be, like, for, say, on a monthly fee?
It would depend on the company and what they offer. So it's plan specifics I can't really go over, but if you'd like to make an appointment with me or call me about that, or even have me send an email regarding that information, I'd be happy to do so.
Pictures, just, glasses and contacts, that kind of thing. But if you need surgery, that's under medical, isn't it?
Correct. So there's two, so the additional vision benefits, so original Medicare doesn't cover things like eyeglasses, right? So those specifics are what could come with a Medicare Advantage plan. So Medicare company A gives you $100 for glasses and contacts, and Medicare company B gives you $200. That's typically things that original Medicare doesn't cover. But things like cataract surgery, that is covered on the medical side, which you wouldn't need a VSP or a vision plan for. Go ahead.
And with cataracts being included with the medical, you would like retina, having a special retina test, going to a special retina doctor, would that be medical too?
Medical, yes, because that would be under with an ophthalmologist, which is a medical doctor of the eye. So that is billed under medical. That is.
When you say vision, I think it's what it's used.
So, okay, there's two parts of vision. So there is a medical side, right, with the ophthalmologist. So you could go get your preventative exam, like your diabetic or glaucoma screening through them, okay? Under original Medicare, that's considered preventative, okay, which is at no cost to you. But if you're somebody who wears eyeglasses and has a prescription for eyeglasses, whether you're nearsighted, farsighted, or both, Medicare Advantage plans offer benefit allowance amount per year for glasses and contacts, frames, and all that kind of stuff. Where if you, let's say, have a supplement plan that doesn't come with an extra vision benefit, they typically don't give you a benefit towards glasses or contacts. I clear that up?
Yeah.
Is that better?
I think it's really confusing.
Yeah, because it's optometrist or ophthalmologist, right? And it's confusing. If we went to an optometrist, think Pearl Vision or Visionworks or America's Best or some mom and pop shops too, where you go, you get your eyes checked, they give you a prescription, you leave. Ophthalmologist would be, okay, they diagnosed a medical condition and now we're going to have to treat it, treat, prescribe, and all that kind of stuff. That would be an ophthalmologist. Correct. Everything that's considered, medically, that you would have to go to a specialist for.
Are most ophthalmologists part of the Accept Humana supplemental?
As long as the doctor takes Medicare, they will accept your supplement insurance. Okay, it's Medicare Advantage that you would check with the insurance company or an agent to see if that specific provider accepts the plan.
Say cataract surgery.
Mm-hmm.
Now they can replace a lens
Mm-hmm.
when they perform the cataract surgery, and sometimes they can design a lens so you don't wear glasses.
Right.
That costs more. Is that covered under this plan?
So that's a little bit more clinical. It would honestly depend on the coding and the billing, and that's a little bit more plan specific. So it would just depend, because remember, Medicare also really doesn't cover cosmetic. So it just depends if it's a medical or cosmetic need or something like that. Go ahead.
I think it's important to remember that when you do have surgery, you probably will get a predetermination of benefits when you go to the doctor.
Yes.
So then you would know in advance
Mm-hmm.
what I would like covered, that kind of thing.
Yes, you can also request one of those too. Yes. Prior to getting a service.
Right.
That is correct. Go ahead.
There's a question online about MMAI.
So MMAI, that is what is specific to those with Medicare and Medicaid beneficiaries. So if you have a MMAI plan, you are what's called dual eligible, where you not only have Medicare, but Medicaid helps pick up your medical costs that Medicare doesn't cover. MMAI plans are like a Medicare Advantage plan. But you have to have Medicaid to qualify, and there's certain plan specifics and plan benefits with those. Any other questions? Go ahead.
Say your drugs in RX, that just falls underneath the Plan D, correct?
It depends. So prescription drugs get billed under your prescription drug plan, right? So that's D. Your D can be provided to you two different ways. One is a standalone drug plan that you pick out and it costs you a monthly premium. Another way to get credible prescription drug coverage is through a Medicare Advantage plan that comes with drug coverage. So it includes your medical and your prescription drug plan in an all-in-one. So when you have Medicare Advantage, you cannot actually go out and buy a separate drug plan to go with that.
It's
one or the other. It won't work.
That leads me up to another question.
Do you want to think about it?
Let me think.
All right, go ahead.
Well, so it sounds like under traditional Medicare,
Mhm.
The doctors and other things can do back billing where Medicare doesn't pay for all of it, and then you're still stuck with the rest. I know in the insurance plan I've got now, you know, the doctor bills for $1,000. My insurance said that should only be 600, and 400 just disappeared.
So that's called Medicare approved price. So no matter what Medicare plan you have, a doctor can bill whatever they want, but as a Medicare beneficiary, they'll always protect you with a Medicare approved price. So let's say Medicare comes in and says, nope, that's actually a $200 service. That's actually what you will be billed on.
So that extra amount goes away.
Right, it's non-existent at that point.
And I take it that extends also into all of the Advantage programs.
Yes, because even if you're on a Medicare Advantage plan, okay, and your Medicare becomes your Medicare Advantage plan, you're not losing your Medicare benefits. You're choosing a private insurance company such as Humana to pay all of your claims. Okay.
And is that also with prescription drugs? I know, again, the thing I pick up says the cost would be this much, the insurance says this, the insurance pays this much.
I don't think so. I think prescription drugs it's a separate kind of entity where this is the drug cost, this is how much Humana is going to pay for it, and this is what your copayment is. And so all that's kind of a little bit separate than a Medicare.
The whole thing where they overbill everything.
With Medicare Advantage plans, I will tell you that because there's copayments and such associated with the service, they cannot, and most plans, and what's called the evidence of coverage outlines it, but balance billing does not exist. So if you go to the doctor and it's a specialist, and let's say on Medicare Advantage Plan A, it's a $20 copayment for the specialist, your out-of-pocket responsibility is $20, and that should be it. They cannot balance bill.
Okay.
Go ahead.
This is a different question. Say if I have to be referred to Mayo Clinic for some type of special service, like an ankle joint replacement, and with that, and I have Humana supplement. What would the cost to the patient be versus being on Humana supplement versus the Advantage plan?
Okay, so when you're on a supplement plan, you pay the monthly rate. Okay, so to make it easy, we'll say your supplement policy costs $200 a month. Okay, so March 1st comes, you pay your $200. Then let's say you still have to meet all supplement plans now, because F does not exist anymore to those after 2020, have at least a $233 deductible, Plan G. So once you meet your $233 deductible, you would have no other out-of-pocket costs. So you pay your $200 a month, right? You meet your $233 on your Plan G, and then there is no other additional cost for you for that service. Okay?
Because, say, I have surgery for an ankle replacement, I'm in the hospital for a day, the doctor bills $30,000. Medicare Plan A, Plan B will pay 80%.
Mm-hmm.
The supplement will pay
the 20%.
The 20% less the copay of the monthly fee.
It's 20% after your yearly deductible is met on that Plan G specific. But again, different letters also have different benefits.
How about Plan N?
Plan N, you meet a $233 deductible, and then there's a $20 copayment at the primary and $20 copayment at the specialist, but no additional out-of-pocket costs after that.
Is that for each visit or is that for
Each visit.
each visit? So it would be better, less money to go with the Plan G instead of Plan N. All the,
It just-
if you foresee having medical.
So again, each individual, right, that's why there's so many plans out there, just meet your specific needs. So for you, if let's say you are somebody who needs all, and again, I can't go into plan specifics, but there's a lot of financial aspects that go into it. So I have people who you do the year, right? What's 200 times 12? Then you're paying the $170 a month to Part B. Then you have to make sure you have a separate drug plan. So you got to take times that by 12. So, you can take your yearly out-of-pocket costs for your premiums and add those up and see what that is. Medicare Advantage plans usually what comes with what's called a maximum out-of-pocket responsibility. So even though, let's say, there are co-payments with your Medicare Advantage plan, there's still a maximum that you are responsible for per year. And then that's it. Whoever were to reach that maximum, then a company like Humana would pay the rest of your medical costs for the year. So sometimes year's premiums are over what maybe a Medicare Advantage plan's max amount of pocket could be for the year. So you could be paying more for a supplement than a Medicare Advantage in terms of that way. But that's one other way to look at it.
As far as demographics, out there, say, the people that's signing up for Medicare that's turning 65. What does the number show? Percentage of people signing up for Medicare Advantage versus supplement?
So
general.
I don't know to answer that specific question. I don't know. Honestly, I don't know the answer to that.
The reason why I asked that, you're watching TV every night and you see all the Medicare Advantage's commercials. You don't see commercials for Medicare supplement. Am I right?
Well, because again, supplements are very cut and dry, right? You buy a supplement plan and you're only getting your medical coverage. That's it, really, right? So they're not trying to, there is no extra benefits for you to look at, where Medicare Advantage companies shoot out different types of advantages to their plan. Like I said, company A could shoot out $300 for glasses. Company B could shoot out $400 towards a pair of glasses per year. But let's say company A only has a couple doctors in their network and company B has all the doctors in their network. It's just, again, when you're looking at each plan, it's just different ways to insure yourself. So if you're someone who's going to take advantage of all the extra benefits and get medical care and keep your line of care because that specific Advantage plan has all their doctors in the network, then that would be great. But if you're someone who is going to Mayo or going to Ohio or going there and you're not someone who's going to get, routine dental done or eyeglass, or you're not going to a Silver Sneakers gym, then a supplement could be right for you. Again, it's based on an individual need.
So for me, I guess that's me. I belong to a health club, so I don't need Silver Sneakers. The eyeglass prescription I have now, 7 years old, and it's still sufficient. So I don't need yearly vision. And it's good to know. I do have cataracts, so it's good to know it's it'll be covered under
medical.
Medicare Plan A or Plan B. Which
it would be B would help cover doctor and out-of-pocket costs.
Okay, doctor's out. Okay.
Did you have a question?
I just think that when you compare them, you have to see what's available for you there.
Right.
Because maybe Advantage might be very limited.
Correct.
Compared to the Medicare.
That's why I always have service area. So it just depends on your service area. It depends on what's provided to you.
When you go from, I went Medicare initially and change to Advantage. But if you go the other way and you have to go, that's difficult to do.
In some cases not. So there are some companies out there that may offer guaranteed coverage for supplements no matter what age or health condition. So it just depends on the company. It's called guarantee issue.
So you wouldn't go into underwriting if you change from Medicare Advantage and you want somebody to go to original Medicare?
Yeah, some supplement plans do guarantee issue.
Okay.
Now, I don't know which one specifically, but I am aware that that could be an option.
So you have to change, I'm not change, but you have to re-sign up every year.
No. So let's say you get your Medicare plan and you love it and you want to keep rolling it over. You just let that baby roll over every year. You don't have to do anything. If you love it and, you know, if you're not interested in anything, again, don't. If you want to take a look at plans, that's when you would take a look at what else is out there. And when you sign another application, let's say during annual enrollment period, if you sign an application and that agent or you're online and it's submitted, that's what that policy after December 7th is what will go into effect January 1st. Let's say you find a plan in October, but then you find a different plan in December 6th, and you want to go with the December 6th plan, and you sign for that one, then that one, so it's the last plan that you signed for prior to December 7th. Go ahead.
You should check your drugs every year.
Right. So formularies change, co-payments change, companies could take a medication off their formulary, add them, etc. Go ahead.
Is it based on the city you live in, the county? you
Zip
live in?
code, county, by county. So I have a member in McHenry County who's best friends with somebody in Cook County, and they could have this completely different plans because her plan might not be offered in her, you know, her area. So
I think my zip code is 3 different counties. You live by one of the corners or something.
yeah, so then you would, that agent, or if you go online, they would narrow it down for you what would be available just for you by zip code. It's the county that your permanent address is. Okay, so think permanent address. Go ahead.
I turned 65 next month, September.
Okay.
I applied for Medicare
Okay.
and I just checked the status and it says, you know, a couple of weeks.
Okay.
So I haven't received my Medicare number.
Mhm.
Can I sign up for Medicare supplement?
They actually, upon application, you need your Medicare ID number and your A and B start dates for that. So you have to wait till you get your Medicare number.
Before I can start?
You can also call 1-800-Medicare and try to get that information before you receive your card. Or you might be receiving what's called an award letter with that information on it. But you do need that information to apply. Go ahead.
So when you sign up for Medicare at 65,
Mhm.
do you have to sign up for the D if you're still working and getting your insurance from there?
No. If you have work insurance, okay, and you're delaying your B, work insurance qualifies as credible coverage because you're
You
choosing.
still have to sign up for Medicare when you're 65.
You actually automatically get Medicare at 65. Okay, so so you get Medicare at 65. Okay, even if you're not taking your retirement benefits. What happens is Medicare automatically grants you the Part A. Okay, that's what you've worked for your whole life. You have 40 quarters, you get your A. That's just hospitalization. There's two scenarios that usually happen. Okay, one could be you take out your Social Security, right, your retirement benefits at 65. You automatically get B, or you can delay B as long as you have credible health coverage. So you're planning on working till 70. You're planning on keeping your work insurance until 70. 3 months prior to your retirement is what I always recommend. Apply for Part B, okay? And they'll take a look that you've had credible health and drug coverage through your employer. And then that's when your Part A and Part B dates are different. Okay?
And then the D, you won't get a penalty for not having it because you've had insurance.
Credible work insurance, that is correct. So typically, for
So you just
example,
apply for A.
you don't have to apply for A. If you're eligible for A, you don't have to apply for A. The only Medicare part you would apply for is your Part B.
No, but at 65, you have to apply for A.
You can request it, I guess, but Part B is where you actually have to send the physical application in for it, and your employer and everyone has to fill it out and verify your insurance. It used to be where they would automatically send your card in the mail, but they don't do that anymore either. So there's that.
So will they email your card or can you just?
They send it by mail.
They send
It's in a little envelope, and you can tell what it is. It has your name and all that kind of stuff. It's very official piece of mail.
If you call them, could they give you, they have a number for you, would they give that to you?
Yeah, you have to do a lot of verification over the phone, but yes, they will if they have that information available.
Is there a Medicare office that you can go visit in person?
Social Security, your Social Security office would help you with your Medicare benefits.
So I know there's one on Lake Street, Roselle.
Buffalo Grove too, I think.
Is there one in
Bloomingdale, Woodstock, Lake Waukegan.
You can make a copy of the card from online.
If you make, okay, yeah, you can. If you have a Medicare portal, you can.
Okay, I opened up a Social Security account.
So you should get updates through there.
So I just looked at it a while ago.
Okay.
It says like 2 weeks. So with my birthday next month,
Mhm.
will I have Medicare Plan A, Plan B? Will it go retroactive to September 1st?
It depends on when you, if you get Medicare at 65 is always, Part A always starts the first of the month that your 65th birthday is in. So September 1st.
Okay.
Mhm.
So if I don't have my Medicare number, and say if something happens, I end up in the hospital, they'll honor.
They'll bill Medicare, yep.
They'll bill Medicare after the fact.
Mhm.
Okay.
Any other questions? No? You're welcome. Okay. If you guys have personal questions and you want to come up to me and ask, I'm more than happy to answer those.
And would you please fill out the questionnaire that is on your page?
For Elderwerks, yes. And my card or my information's on there if you want to grab that and call me at a later time, or you're interested in more information during annual enrollment period, let me know and I'll be happy to help you guys. Thank you very much.
So are you with Humana or are you a broker?
I'm with Humana specifically.
As you may already know, Elderwerks is a not-for-profit organization supporting any older adult or senior who has aging questions, needs referrals for assisted living, memory care, home care agencies, or other senior housing options. Our complimentary services are always available to you. Just give us a call at 855-462-0100 or visit our website, elderwerks.org, elderwerks.org, where you'll find hundreds and hundreds of articles and supportive material to help you through the aging process. Again, thank you for taking aging seriously and planning for your future needs. Enjoy Elderwerks Expo.
Hi, everyone. It's Carol Razzo. I'm Senior Strategy Director at Elderwerks, and today we're very fortunate to have our Platinum sponsor, Vicki Madigan of Madigan Insurance Group. She is agent, broker, and owner. And Vicki, if you would share your expertise with us today, what is a key point or something very important that you think seniors and their families should know approaching enrollment coming this October?
Well, thank you for having me. And regarding the annual open enrollment period, that is every year. It never changes. The dates don't change. They're October 15th to December 7th. And all Medicare eligible beneficiaries, either if you're coming into Medicare for the first time, need to meet with an agent to find the most appropriate plans for you. If you're currently enrolled in Medicare plans, this is the one time a year opportunity that those Medicare beneficiaries get to review their Medicare supplement, their Medicare drug plan, or their Medicare Advantage plan. So it'd be very important for them to meet with an existing agent. If they don't have an existing agent, then they're welcome to call our agency at Madigan Insurance Group in Huntley, and we would be glad to help them, or we can meet with them at the senior fair as well.
Thank you very much, Vicki. And we are looking forward to everyone enjoying the senior fair and for you to hear Vicki's presentation in addition to visiting their booth. Have a great day.
Hello, everybody. I'm Gail Nixick with Elderwerks. I'm the Vice President. I'm here today with Carrie Peck, the Managing Partner of Peck Ritchie, who's kind enough to join us and be a gold sponsor of the Elderwerks Aging Better Expo. I would like you to meet Mr. Peck, and Carrie, if you can just give us a brief, something to share with individuals when they're thinking about planning for an older adult, what is important for them so they can avoid a crisis.
Well, Gail, thanks for inviting us. As you know, I'm going to talk about celebrity estate battles at the upcoming event. But I think that what people forget is whether you're a celebrity or whether you're not, everybody needs to do advanced planning. And the reason they need to do advanced planning is because you don't know when you're going to get hit by a bus. You don't know when you're going to have a stroke. You don't know when you're going to fall and break a leg and be unable to get off the ground. And the reality here is the most important thing you can do for yourself and your family is plan in advance. Here in Illinois, we have two types of durable powers of attorney. On my one hand, it's a durable power of attorney for property, which is management of assets. On the other hand, it's a durable power of attorney for health care, which is management of clearly healthcare decisions, what doctors you're going to, where you're going to live, who's going to perform surgery upon you, when you're not capable of making these decisions. And none of us ever believe that we're not going to be capable. All of us believe that all the way until the end, whenever that is, whatever end that is, we're going to be in charge and maintain our own mental faculties. The reality, ladies and gentlemen, is we aren't. Statistics show we aren't. So planning for lifetime planning is just as important as planning a will or a revocable living trust for post-death planning. So at the end of the day, what's the takeaway? The takeaway is do advanced planning. We are all mortal. We like to think we're immortal. We like not to face our own mortality, but it's important that we do because our families will thank us for it later. Thanks so much, Gail.
You're very welcome, and thank you. That is such excellent advice. We hear it all the time, and we know that this happens. You know, if they could avoid this, if they would just do planning. So I invite everybody to join and watch Carrie as he presents at Legal Planning Celebrity Estate Battles at 10:30 to 11:30. And thank you again for joining us and being one of the gold sponsors, Carrie.
Our pleasure. It's a great organization to work with. Take care.
We appreciate that. Thanks again.
Bye-bye.
Bye.
Hi, I'd like to introduce Sylvia Spiegel, Senior Sales Manager with Humana. And welcome and thank you for being a Platinum sponsor for our expo today. Sylvia, why would a client choose Humana for insurance and Medicare needs?
Yeah, thank you. So really happy to be here and join you. We understand that health needs are very important, and the health needs also sometimes go on beyond Medicare needs. So what we mean by that is that we are here to guide our Medicare beneficiaries through their health plans, and also adding an extra touch of what we call human care. So we want to make sure that we address social detriments, provide the right plan benefits for them, and just help guiding them and helping them take a proactive approach in their own healthcare needs.
Thank you.
You're welcome.
I'd like to introduce Anna Sampley from the Alzheimer's Association, one of our silver sponsors today. And the question that I have for the Alzheimer's Association and Anna is, why is the Alzheimer's Association the best resource for a family member looking for answers to start to help a loved one?
Hi, Barb. Thanks so much for having us. The Alzheimer's Association is the leading volunteer health organization in Alzheimer's care, support, and research. We work to provide care and support for all those affected by Alzheimer's and other forms of dementia. Our free nationwide 24/7 helpline, which is 800-272-3900, is staffed by master's level clinicians and specialists, providing confidential support and information to all those affected in over 200 languages. We also conduct face-to-face and virtual caregiver support groups and early stage groups, as well as education programs in communities nationwide, and we work to ensure that those services reach underserved population. We also have an online community forum, Alz Connected, which provides a place for people with Alzheimer's disease and their care partners to connect with others, share questions, find answers, and share opinions with individuals or groups in the Alzheimer's community. We provide caregivers and families with comprehensive online resources and information through our Alzheimer's and Dementia Caregiving section located at alz.org, which features sections on early stage, middle stage, and late stage caregiving. We make it easy for families to find programs and services also using the Alzheimer's Association and AARP Community Resource Finder, which is a comprehensive database on dementia and aging related resources. So essentially, we provide care and support, we educate and raise awareness, we accelerate research, and we advocate. We invite you and all those to join our cause. Visit alz.org to find your local walk to End Alzheimer's, which is the world's largest fundraiser for Alzheimer's care, support, and research.
Thank you so much.
Hi, I'm Carol Razzo, Senior Strategy Director at Elderwerks, and we're delighted today to have a brief conversation with Mike Iwaniki. Mike is with the Veterans Assistance Commission out of McHenry County and a silver sponsor for today's event and a wonderful supporter of Elderwerks for our veterans, seniors, and their families. Mike, your expertise, can you share with us a key tip that you think would be valuable to the veterans and their families that are with us today?
Absolutely, Carol. Thanks for asking. I think the most important thing to consider is if you or a loved one who's a veteran has a need, just simply ask. One of the key things we need to be looking at right now is asking the right person, and the right person is going to be an accredited veteran service officer. An accredited veteran service officer is someone who's gone through the training and is authorized and certified to represent a veteran and their claim and their needs before the U.S. Department of Veterans Affairs. And it is so important to get someone who's accredited. There are so many people. You can go online and you can who claim to be experts, and I'm sorry, many of them are giving very bad advice. I'm regulated by the VA. My counterparts in other VACs have their VA accredited as well. It's really important to reach out to them and they can help. As for asking, each county VAC is a little unique. At ours, we have something called Caregiver Relief Veterans Assistance. So if you are caring for a veteran, or you're caring for the surviving spouse of a veteran, or maybe even both, and you live in McHenry County, we may be able to help you out with some assistance where you can get help so you can get a break So the caregiver can go out and get themselves a cup of coffee, get their hair done, go visit with friends, and do those things that are so important to keep you in good shape.
Thank you, Mike. Very good point. And definitely on the caregiver side, taking care of yourself is extremely important. But I think you've really expanded on there are resources, and you have to take advantage of those resources and know that you're going to be authorized and the most appropriate people. So Mike, thank you very much. And thank you to the VAC for supporting us today. And I know we're all going to be enjoying your presentation. Have a fabulous day.
Thank you.
I'd like to say hello to Erica Moore, silver sponsor from Assured Home Healthcare.
Hi.
And hi. And the question for you is, how do your caregivers help keep Assured Home Healthcare clients engaged?
Well, we have like private duty services. We have a nurse that comes out and we do a detailed care plan. So then it fits the client's needs. We offer 4-hour shifts, 8-hour shifts, or even 12-hour shifts to just have that companionship with the client and more support. We do the ADLs, appointment runs. If they need any social activities, we can do that. I said errands too, we do. And just engaging at the home, you know, they're able to be at home free. So we just take pride in that and letting them be able to do their activities at home.
That's really, really nice. Thank you very much for your time.
You're welcome. Thank
Talk
you.
to you again.
Hello, everybody. I'm Gail Nixick with Elderwerks. I'm the Vice President, and I'm here today with Sahava Miller, the Home Care Liaison with the Key, a silver sponsor for the Elderwerks Aging Better Expo on August 31st. And we're so delighted to have you, Sahava, today with us. And one of the things I was wondering if you could share with everyone is, what do you see as the benefits of people reaching out to a caregiving agency as opposed to hiring maybe a family member or an acquaintance or someone they might know? How do you see it as a benefit to them when they reach out?
Yeah, no, thank you for having me today. And one of the benefits is being able to have a replacement. If you have a caregiver that is a family member or a friend and they're not able to come, it's much harder to find someone that can fill in and provide care when you really need it. When you work with a company, you can call and talk to a staffing manager, a client care manager, and they will help to find a replacement for you right away, especially somebody who needs care ongoing. You know, they don't want to be without a caregiver. It's important to know that they have somebody coming in there. And also if there's any, concerns you can reach out to the company that you're working with to help, get you through those concerns. Or if you need to find a different caregiver, you're able to find somebody else. So those are really the big differences and importance of going through, working with the company. And with the company too, that the person is bonded and insured, and that they check the backgrounds and confirm that the person has that experience and is available to work.
Great. And my understanding is that, all the caregivers have worked for an agency for a sufficient amount of time. So it's not just hiring someone new to the industry and helping older and disabled adults, correct?
Correct. They all have to have a certain amount of years of experience. And then they also, I think with any company that they work with, they go through training. We specifically have, for example, a whole day of training on different topics such as dementia and Alzheimer's. So they really have to go through continuous training as well to make sure that they're qualified and able to work with the clients.
Oh, that's very helpful to know. Well, thank you for sharing that. And we invite everyone to meet Zahava and the rest of the representatives from the Key at the Aging Better Expo on August 31st, and we look forward to seeing you there. Thank you so much.
Thank you. Looking forward to it as well.
Hi, I'm Carol Razo, Senior Strategy Director at Elderwerks, and I have Sue Grossinger, who is Senior Service Coordinator at Advocate Good Shepherd Hospital and a silver sponsor with us today. Sue, could you share with us a key point as we age that you think would be beneficial to seniors and families?
Sure. Actually, I kind of have two key points. I'll try to make it brief. My first key point I want everybody to realize, and this is a perfect environment to talk about this, is there are people out there to help you. There are tons of resources, and that's why this Elderwerks Fair is so beneficial, is because you can really see how many organizations, agencies, lots of different providers in the senior network, the aging network, that are there. So don't ever feel like there is not somebody or something out there to help you, because there is, and you just keep digging. And you know, when fairs like this go on, if you don't need it now, you may need it in the future. So always hang on to that information. My second point is, which kind of ties into this, don't wait until you're in a crisis. And that's why I say, take this information, hold on to it, have conversations with your spouse, with your family, so that when something does happen, you know, your family knows, you know, what your wishes, what you want, what you may need, so that you're not having to deal with things in a crisis is very, very difficult. And you don't always get the choices that you want. You're not always able to make the choices that you think are best for you. So it's really important, plan ahead, make decisions, have conversations with people, save all this information about all these resources that are available to you in the Aging Network, so you're one step ahead if something should happen.
Sue, thank you so much. And those are very important things to keep in mind. And I hope everyone will benefit from it today at the fair. And thank you very much to Advocate Good Shepherd Hospital for being a silver sponsor.
You're very welcome. We're glad to be a part.
Without proper estate planning, family members pay the price. Oftentimes, the result is an expensive probate court battle to obtain guardianship, and eventually, the settling of an estate after a loved one's passing. From those with modest means to the very wealthy, this happens to families on a daily basis. Peck Ritchie is here to help. We can serve and guide your family both in and out of the courtroom, so you can find peace at home.
So I'm here with Heidi from Paxum. Heidi, thank you so much, and thank Paxum for being a silver sponsor for the Better Aging Expo here with Elderwerks. Thank you for all you do to support seniors. Could you share a helpful tip for seniors with us today?
Hi, thank you. I think one of the best things you can do is try to start looking into places for moving ahead of time and to start going through that process before it becomes an emergency situation, whether that would be for health concerns or with the passing of a loved one and needing to downsize, and also going through items. And that would be with your kids or passing along things down to your grandkids. Slowly start that process now, so your move can be a little bit more enjoyable as a move can be. But doing that now so that it doesn't turn into an emergency situation where that can become very stressful and overwhelming and really hard.
Thank you, Heidi.
Thank you.
Choosing a Medicare health insurance plan is complicated. Using an agent can help you make sense of the Medicare process. Change your Medicare experience with Madigan Insurance Group. Our licensed staff members provide education to help you understand all of your Medicare choices and make sure that the plan you select is specific to your personal health and financial needs. When it is time to enroll, you can be certain that you have the most accurate information to make an educated enrollment choice. We can secure your same benefits for a lower price by shopping the market for you. To better meet your needs, local agents provide personal service. We can answer all of your Medicare questions. From Medicare, individual health, and other health products, we are here to help. Stop wasting time on guesswork. Come to one of our free Medicare Made Clear seminars to learn how to maximize your benefits and how to avoid penalties that last your lifetime. To get started, call Vicki Madigan for a no-cost needs assessment. Call 847-457-1802 or visit madiganins.com.
Thanks everyone for joining us today, and we're very fortunate to have Brian Edelman, Executive Director at Belmont Village in Buffalo Grove and one of our silver sponsors. Many of our families are fortunate enough to be working with Belmont Village and have loved ones living there at this time, and they are experts in assisted living as well as memory care. So Brian, could you share with us a few points and key thoughts you have regarding what seniors as they age and their families and loved ones should be aware of and really look forward to going forward?
Thank you, Carol. Yeah, and thank you for having me to chat for a few minutes. The first thing I think families ought to consider when they're thinking about senior care and kind of supporting their loved one is really being prepared, and thinking through what is going to happen should something happen to mom or dad or your loved one, whoever that may be. So not waiting for that crisis. We know that things come up and things happen, but really doing your homework and know what the plan is going to be should something happen. So God forbid, a crisis happened in your family. What's the plan? So communities like ours can certainly be a part of that solution of being able to go into place or jump in and help should crisis happen in the family. I think the second thing is really thinking through who that support system is going to be. So it can sometimes be a burden to care for an older loved one. And we've heard many seniors say, I don't want to be a burden to my children. I don't want to give them work to do or to be a hard time. So thinking through, in order to maintain that relationship as simply the daughter or simply the niece or nephew or whomever, how can you take that burden off of your shoulders? And again, communities like ours, home care, different types of companies are available to help provide that kind of support. And really the third thing that comes to my mind is really that engagement. One of the top concerns we hear about seniors in their home is about loneliness and isolation. And it certainly is not a new problem, but, the COVID quarantines obviously made it more of a challenge that, seniors were really stuck in their homes. So how can our seniors get more engaged? And we've found that, especially with folks with early onset memory loss, that having that engagement helps to not necessarily prevent, but certainly slow the progression of any cognition or disease process that happens. So finding a place or a community setting where someone can really have that engagement, be around others, both peers, seniors from their own generation, as well as the support staff there to help provide that engagement.
Thank you so much. All of those excellent points. And you're all going to have the opportunity today to visit our vendors. And of course, please be sure to go to the Belmont Village vendor table, and they can give you more information. They're excellent engagement programs that they have at their particular locations. And so thank you, Brian, for being with us. And we appreciate you participating today.
My pleasure. Thank you, Carol.
Jeanette from Right at Home is joining us, and I thank Right at Home for being a silver sponsor for the Better Aging Expo here with Elderwerks. Jeanette, could you share with me a couple of thoughts on seniors that want to age at home and what they should be planning for in the future?
Thank you, Nina. Yes, I'd love to share that information. 80% of the population wants to age in place. So the best thing to do is start looking at the home. Look for areas that could use modification in the event there was an ailment. Is the bathroom big enough? Is the tub accessible? Actually get rid of the tub, really. And, talk about those things with the adult. The adult children need to help with the parents too. And then I guess the best message would be to get rid of the throw rugs. That's the number one safety hazard in homes, and people keep them. So as we age in place, we need to get rid of them.
Thank you, Jeanette.
You're welcome.
Katie can quit playing with her microphone.
If you do get a question, you can repeat them for the folks online. That'd be lovely.
Live stream. Well, good afternoon, and thank you to everyone for joining us today.
And we really appreciate your support. We hope that you found this as interesting and beneficial as we have. And the commentary and feedback has been wonderful from everyone that has talked with us. So we so appreciate you coming in. So I think now we're winding up the day, and we're so glad that you came in to attend the last presentation. I'm Carol Razzo. I'm with Elderwerks. I'm a senior strategy advisor, and as you know, we're non-for-profit. We can help you with any needs you have for seniors. Any resources, we do not charge for our services. And you can see from today's event the amount of partnerships and resources that we have. So we hope that you'll continue to work with us and utilize us to your benefit. We help everyone regardless of financial situation. So we do appreciate it very much. And we certainly could not do what we do and service our clients and the families that call us to the extent we do if we didn't have wonderful partnerships. And one of those very valued and very important partnerships with us is Dutton Casey and Mazzarales, elder law attorney firm, and they are wonderful and fabulous. We know that whenever we refer to them, our clients are going to be taken care of properly. Our families are going to get the information that they need. And really, we're going to get wonderful feedback, which is ongoing and always happens. One of the people we like to recognize at Dutton Casey Mazzarales is Monica Diorio. She's sitting in the back trying to hide. One of the wonderful things at Dutton Casey Mazzarales is that they have used a social worker on their staff as a team member, and that gives a whole nother depth of information and resource connection. And Monica is the client coordinator and really is just excellent, so we always can refer you to her directly. One of the other, all the attorneys are fabulous, but someone I have a special fondness for and work with very often with my clients is Kathryn Casey, really known as Katie. And Katie is partner and elder law attorney with Dutton Casey and Mazzarales. And I want to thank both of you while you're here publicly for all that you do for our families and clients and the resources that you offer. And we can always count on them that whatever is needed is correctly done, and very supportive of everyone. So I hope you'll enjoy hearing about asset protection and Medicaid. And I know that Katie will be available to answer questions following that. And we'll be looking forward to your responses on it as well. So Katie, thank you so much.
Thank you, Carol. Thank you so much for having me. Thank you all for being here. I cannot express how much our law firm relies on Elderwerks to support our clients through extremely difficult times. We are lawyers, and lawyers are limited. We do only certain things. We're not magicians, fortune tellers. We cannot fix every problem. We consider ourselves one part of a larger team, which has to include professionals like Elderwerks because they have so much experience, wisdom, and insider knowledge about the aging industry. My clients could not navigate difficult decisions without their support. In addition to working with professionals like Carol, we also work very closely with social workers, both inside and outside of our law firm, because they too are extremely important, particularly geriatric care managers, in supporting our clients. And we often work with financial advisors and CPAs as well. So it really does take a team to help my clients navigate their problems. I have to confess, this is the first time since the pandemic started that I have been in front of a live audience. It is wonderful to see you. And today we're talking about a very challenging, very serious topic, which is asset protection and Medicaid. And you might wonder, many people wonder, what is Medicaid for and how does it apply to me? Medicaid, to give you a little bit of history, is a federal program that was started decades ago to address the problem of people who were low income and low assets who didn't have basic health insurance. We're talking about just getting little kids, pregnant women, and seniors without a lot of resources to the doctor through a hospitalization. Medicaid was intended from the beginning to simply provide health insurance coverage, very much like Medicare, but for people who didn't have any funds. What it has become today is the nation's long-term care insurance policy. It now has expanded and has been expanded for quite some time to cover people who don't have enough resources to pay for the cost of care. Basically, it picks up where Medicare ends for most people. And unfortunately, and I could, but I won't, speculate on why Medicaid applies to so many people now. But the vast majority of people who I see cannot afford to pay for long-term care, whether at home or outside of their home, for any significant period of time without considering Medicaid coverage. So essentially, long story short, is Medicaid applies to basically all of us. It is very likely to apply to us or one of our loved ones at some point as we age, particularly if we are diagnosed early with a chronic illness or an aging issue that is going to require hands-on care for the rest of our lives. So really, we need to start thinking about Medicaid, ideally before we retire. And we want to start thinking about long-term care planning in the sense that because Medicare doesn't cover everything, we need to save money to pay for our care. And for most of us, saving money is going to help a little bit, but it's not going to solve the entire problem. And so we will want to consider Medicaid to fill in the gaps at some point. I want to talk about Medicaid for everyone. And before I do, I want everyone to be very clear that these are not my rules. I did not make them. I had nothing to do with the creation of these rules. I am a lawyer, and my job as a lawyer is to simply communicate to you what the federal government and the state government has decided is in your best interests. So these are the laws of the land. These are the laws that apply to everyone. I'm going to try to keep my opinions to myself about them. Many of them you're going to find really disturbing and upsetting. And I just want you to know I had nothing to do. I had nothing to do with any of it. The law separates people into two groups. And those groups are people who are married to each other legally or in a civil union under Illinois law, and people who are not legally married to each other. So one of the laws and flexibilities is that it does not acknowledge a lot of the relationships that we consider very special and important in our lives. A lot of us are in relationships the law is not going to acknowledge as important. And the second part of our presentation will be dealing with the problem of how do we take care of loved ones who the state doesn't acknowledge as being a legal relationship with us. So first we're going to tackle rules, the Medicaid rules that apply to married people. And the Medicaid eligibility rules are going to apply mostly either in your own home or in a long-term care setting. And when we are in a long-term care setting, we have two distinctions. We've got the community spouse and the Medicaid applicant. So you got two people married to each other. To give you an example, I'll have a husband and a wife come to me with a problem, and the problem is that the husband has been diagnosed with dementia and is in the early stages. The wife has not, and they are worried about how they're going to both provide for the wife, the husband, and the rest of the family through this illness. So the community spouse is the person who stays either at home or in an assisted living facility. The Medicaid applicant is the person who's applying for benefits, who wants care either at home or in a skilled nursing facility. This is the marital unit. Spouse and spouse, might be husband, wife, might be white wife. It's a legal marriage under the law. If you are legally married to someone, the ordinary Medicaid rules are that you can't have much money. You are allowed, between the two of you, spouse and spouse, to have $109,000 in resources. That includes IRAs, CDs, stocks, bonds, retirement accounts, anything in the bank, anything in the safe deposit that's of value. I've had one client in my entire career say to me, and she was, I think, 95 years old and had lived through the Depression, probably never thought she'd have $100,000 ever to begin with. And she said to me, Katie, I am absolutely happy having $100,000. Perfectly content with that. 99% of the people I see are very, very upset when I tell them that they cannot have more than $109,000 in assets. Fortunately, you are also allowed to have certain other assets that are considered not countable, things that Medicaid will not hold against you, one of which is your home, another of which is the stuff in your home, a car, life insurance policies, burial funds, burial plots, and whatnot. So these assets don't count. And they can be a very good way to creatively get us down to the $109,000 if we're not already there. Homestead, however, can be a problem. So you're allowed to have a home if you're married, but in order for it to be exempt, your spouse has to be living in it. So that community spouse has to be in the house. Your community spouse can't be in assisted living. So if you're in a long-term care facility and you've got a spouse in assisted living, your home is not exempt. That community spouse has got to be physically living there. Or maybe she's living with her sister or your daughter. I mean, the house is just empty. That too is a problem because it's not going to be exempt in that situation. Other factors that will make it exempt, though, include, and I have lots of clients who come to me with a disabled adult child still living in the home. So a disabled adult child of any age is going to make that property exempt. You cannot be forced to sell a home if you've got an adult disabled child living in it. You also can't be forced to sell it if you have a minor child in it, which has happened on occasion. And you cannot be forced to sell it if you have a caregiver child living in that home. And we'll talk more later about what a caregiver child actually is. There are some downsides to being married, which no one tells you before you get married. One of which is that if you are married and your spouse needs long-term care, you must cooperate with the application and you must disclose all of your assets. Swiss bank accounts, Cayman Island assets, whatever you've got, fancy boats, it's all got to be disclosed to the government. They get to know everything as long as you're married. And this can be a problem if you have a spouse who you never divorced, because cooperation from both spouses is required, even if you have not talked to this man for 50 years. Also, very unfortunately, all of the assets count. So everything in both spouses' names counts. It's not just the spouse who's applying for benefits. So that $109,000 applies to everyone in the marital unit. The income rule is particularly harsh when we're married. So if our spouse needs Medicaid, we, as the community spouse, are not permitted to have more than $2,739 in income. That's what we're allowed to have. If we don't have that, we can take it from our spouse who's going on Medicaid. If we have more than that, fortunately, we do get to keep it. But you can't pull more than $2,739 from the spouse going on Medicaid. That amount, fortunately, is, for the first time in the entire 20 odd years I've been practicing law, is actually going up next year to approximately $3,000. So that's some good news. You can ask that you get more than that. So I have had spouses who are still suffering under a mortgage or student loan debt, or they've been putting their kids through college and they really don't have a lot of spare income. And we can ask for a higher amount than $2,739 if we can show that it's necessary. So imagine a situation where a husband is in a nursing home and a wife is at home still putting kids through college. And the husband in the nursing home has $5,000 in a pension income, and the wife at home is only able to work part-time. And her income is extremely low. And she's got a mortgage, she's got these kids in college, she's got all these expenses. An argument can be made, and it has been granted, that additional income can flow from the spouse in the nursing home to the spouse who's still living at home. What about if you're not married? So this is basically Medicaid for everyone else. And this is where we have problems when we're in a relationship that the law doesn't recognize. So if we're not married, if we're partnered, if we have a significant other, if the law does not recognize our relationship, the law says you're basically unmarried. You are treated as an individual. And these rules are particularly harsh. So if you are a single person attempting to qualify for Medicaid benefits, the law says you cannot have more than $2,000 in assets. You get $2,000 in the bank, $2,000. On top of that, you get to keep your home, but only if you're living in it. You can keep the stuff in your home. You can have a car, certain life insurance policies, burial spaces. What's most important that you get to keep is a third-party special needs trust, which was established maybe by your parents, your grandparents, or another loved one, or a special needs trust that you establish for yourself with the money you have above $2,000. So let's say you need Medicaid. You have more than $2,000. You have $200,000. That $200,000 relative to the cost of monthly care at, let's just say it's $15,000 a month. I can't even do the math here, so help me out. What have we got? Maybe a year, 2 years of money before it's all gone. If it is placed in a special needs trust, the money counts as $0. So you could conceivably have $200,000 in resources, which would disqualify you for Medicaid. But if it's in a special needs trust, it counts as 0, and you have now qualified. What legal ways are there to keep more than $109,000 plus the house, plus the cars, plus the burial spaces? There are legal avenues to keeping more money than what the simple rules allow. And we're going to cover first what married people are allowed to do. Keep in mind that this is only in Illinois. So these laws are very special to Illinois. Illinois treats married people very, very differently than other states. I want to give you a scenario. What if we have a married couple and there is $50,000 in the community spouse's name and $200,000 in the spouse's name in the nursing home? Under Illinois law, and do not ask me how this happened, you are allowed to transfer all of your money to your spouse. So all of the money in the spouse's name who's in the nursing home can legally be transferred to the spouse who's still at home, even during the look-back period. So how many of you out there have heard about, well, you can't give away money because of the look-back period? There's the look-back period, right? There's a 5-year look-back period now. I think it used to be only 2. It's been 5 for a while now, and what that look-back period means is you're not supposed to give money away 5 years before filing for Medicaid benefits. The whole policy behind that is we don't just give it all away and then qualify for Medicaid the next day, right? But in Illinois, if you're married, it's okay to transfer everything over to your community spouse, even within that 5-year period. What about just giving it all away? So I have lots of people call me and say, I'm terrified, all of mom's money, all of the money, it's going to be gone. It's going to be gone in a number of years. Can she just give it all away now? Can she just give it all away and then get Medicaid? And the answer is generally no, but there are some legal exceptions. Generally no, it is a terrible idea to simply give away all of your money for a couple of reasons. First of all, if you give it all away, how are you going to pay for care in the event you don't get Medicaid? If you can't pay for care and you don't get Medicaid, a facility is legally allowed to discharge you. Oh, yes. So they are not obligated to keep you if you cannot afford to pay and you've been denied Medicaid eligibility. You can legally give money away if you give it away 5 years in advance, right? Because it falls off the radar. But what if we give it away 5 years in advance and no one can see that we gave it away? Yes, you can technically do that, but I urge caution with that plan for a couple reasons. One of which, let's go back, is the risks involved are if you give too much money away and you need expensive care, you're not going to be able to get through that 5-year period. And then what happens if the money you gave away is all gone? What if you give it to your son? What if you give it all to your son and you say, hold it for me? And the next thing you know, your son, who had a child who he never told you about, it's happened, is suddenly subject to a child support order in the state of Oklahoma, and all of the back-ordered child support is now being assessed against the money you gave your son. Oh yeah, so the money might not be there if you just give it all away to a child to hold for you. You might not have the money to get through that period. And there's also the costs involved. This is a plan which really requires you to work with a lawyer. So you have to work with a lawyer. You can't just give term money over to somebody because it might not be protected from creditors. It might not be protected from their spouse. What if they get divorced and their spouse takes all of the money in the divorce settlement? You can't just give it all away because you won't have enough money to pay for care to get through the 5-year period and you don't want to be on the street. You need to work with an attorney and do a very, very careful calculation to make sure that you're protected before you give it all away. Yeah, you can give it all away, but very bad things can happen if you don't do it correctly and in a safe way. I personally like to do it with an irrevocable trust, which is a very special trust where if you put the money in, no child support order, no divorce settlement, no creditor, no adult daughter who suddenly just decides to blow all the money at, Neiman Marcus, no one can misuse that money or seize the money. It's in a safe, protected place. So if, God forbid, you don't get Medicaid when you need it, the money is still sitting there. That money you gave away, it's still sitting there and it can all come back and still be used to support you for your care. One of the easier ways to deal with being over the asset limit if you're married, imagine this scenario. Husband and wife, we've got a house with a mortgage and we've got essentially $200,000 between the two of them, right? So we're over the $109,000 limit. What if we just pay off the mortgage? What if we simply pay off that mortgage? And so now the community spouse is down to $109,000 plus a house. The husband in the nursing home can now qualify for Medicaid. And once he's eligible, the wife can sell the house at any time and keep the money. Once the spouse is approved for Medicaid, no one's counting anymore. You just have to be down to that $109,000 before you apply. So paying off a mortgage is a great idea. Paying off other debt can be a great idea as well. Making improvements to the home. I often tell clients who say, well, I've got too much money, I'm not going to qualify. It's like, well, when did you last replace the furnace? Is the roof going to go next year? Does the driveway need to be resealed? Do you need to remodel a bathroom? I mean, if you're going to live in this house, or even if you're going to sell it, in order to get good value for the sale, what do you need to do to either live here comfortably or get a decent price when you sell? Let's spend the money on that home and get it up into better condition. What if you're above the $109,000 and you're still driving a 30-year-old car like I am? You can upgrade, buy a new one, get a new car. If you haven't purchased your prepaid funerals and burials, do that. That's another great way to get the asset limit down. Another great way to get rid of excess assets is to take care of a loved one with a disability. Imagine this scenario. Mom has 3 children. 2 of them are employed and doing great. One of them has been disabled and living with mom his whole life. He's never had a job. He's never been independent. Mom's assets are going to be exhausted during her lifetime. Who is going to support the adult disabled child? The Medicaid regulations allow you to give all of your money and resources to your adult disabled child or to any disabled person. You can give them to them outright and let them manage them yourselves, or you can give the money to them through a special trust. But essentially the policy there is we don't want mom spending all of her resources until she has absolutely nothing at the cost of the adult disabled child now being completely unsupported. What about buying an annuity? Has anyone bought an annuity? Does anyone understand the annuity they bought? I'm a lawyer and I have a really hard time understanding them. They can be the most wonderful tools if you do them correctly. And I urge people, if you're considering purchasing an annuity, get advice on what you're buying and how you're structuring it, because Medicaid's gotten super technical and I'm not even going to go into the rules on annuities. But suffice it to say that if you're married, and like so many spouses that I frequently see, one spouse has got a $400,000 IRA and the other spouse has got absolutely nothing. What can we do to fix this balance? What can we do to protect some of that IRA? What happens if you take all of the money out of an IRA on one day? You're taxed, and you are taxed like you wouldn't believe. Yeah. So you do not want to take all of the money out of the IRA and give it to your spouse. That would be very, very bad. But what you can do is you can convert your IRA to an annuity that pays income to your spouse. So maybe you can't transfer your $400,000 annuity to your spouse, but you can turn it into, I don't know, maybe $6,000 a month in income and get it over to your spouse. And that is a perfectly permissible way to protect assets and still qualify for Medicaid eligibility. So it's great because you're avoiding all of those taxes. And it's wonderful because you are increasing the income to the spouse who still lives at home. Refusal to support is the number one way that most married people are qualifying for Medicaid when they have more than $109,000 in resources. And this option under Illinois law has been available for since 2012, since the laws changed in 2012, but it's not well known even in the elder law community. And this is the law that says that if you're married to a spouse who's in the nursing home and you have in your name alone more than $109,000, let's say you've got $500,000. If you sign a statement stating that you're refusing to use that money to pay for care, and if your spouse in the nursing home signs an assignment of support rights to the state, you as the community spouse are allowed to keep all of your money. Yeah, you heard me right. It's very, very little known in Illinois, and it's only in Illinois that this provision applies. So essentially what this means is that if you're a community spouse, you are permitted to keep more than $109,000 in resources if you do it correctly. The downside of it is that the state is able legally to come after you for a support payment. Because here's another thing they don't tell you when you get married in Illinois. When you get married, you are legally obligated to financially support your spouse. You have to pay all their bills, at least all their medical bills. So if you have a spouse on Medicaid and you've refused to support to keep your $500,000, the state has the right to ask you for a support payment. So the biggest question I get is, well, Katie, how much are they going to ask me for? I mean, what are they going to want? Is it going to be, more than I'd spend privately paying the nursing home? Is it going to be less? What's it going to be? And I have to say, I have no idea what it would be. All I can tell you is it certainly would not be more than what Medicaid is paying that nursing home for the benefits they're paying. But I can't tell you what the support payment would be because the state has not yet asked anyone for a support payment. So they have to have procedures in place to ask for a support payment. They've got to have rules and regulations governing. They can't just willy-nilly go out there and say, you know what, from you I want $500, but from you I want $1,000 without, any rhyme or reason. So there has to be some procedure in place, and there just isn't any. So there's just no guidance on what the support payment would be. Most spouses I meet with say, I'd rather pay a support payment to the state and keep my $500,000 than have to pay the cost of private pay until I'm financially down to the $109,000 and see what the support payment ends up being. Yeah.
Would this also apply to someone who's exempt as an adult caregiver child? If the assets are transferred to the child within that look back period?
It does not apply to adult caregiver children. Well, we're going to talk about caregiver children because the only thing that you can do for caregiver children is transfer a home in certain circumstances and pay them for their caregiving. But you otherwise can't just give a caregiver child money, at least not within the 5-year look back period, without falling afoul of the Medicaid regulations and losing eligibility. Hold that thought. I have slides on that. So to divorce or not to divorce, I have lots of people in my office saying, Katie, should I get a divorce? And that's a really hard question because if you do get divorced because you are afraid of the cost of your spouse's long-term care, how will you make out in the divorce? Will you end up doing better financially or will you end up doing worse? A divorce has to be equitable. You cannot simply divorce your spouse and take everything. It has to be equitable. So it's got to be fair. So some people are going to end up better. Some people are going to end off being worse. You lose a lot of benefits if you're divorced. You no longer have the right to make decisions for your spouse. You no longer control their care plan. You no longer have that right to inherit any benefits from them. Now, your spouse might be going on Medicaid, so you might ask, what could I possibly inherit from him? But what about life insurance benefits? What about survivorship benefits under pension plans and whatnot? So it's a very difficult question and really warrants both an elder law attorney and a family law attorney to figure out if you're in a better or worse position for divorcing. What if you never got a divorce? This too happens regularly. People are still married. It's been 50 years. They are estranged. They never went through all of the legal rigmarole to officially get divorced. And who can blame them? It's a pain to get divorced. But even if you're trying to get on Medicaid and you are still legally married, your spouse is required to disclose all of their assets and their assets count against you. So there can be some serious problems if we are estranged and not divorced. Yep.
Quick question. If both people are receiving Social Security benefits, the person goes into a nursing home, does that person's Social Security money go towards the nursing home then?
When you
spouse doesn't get that part of Social Security then?
It depends. Yeah, so it depends. So if you're married and your spouse is in the nursing home, you're both receiving Social Security. If you're at home and your total income is more than $2,739, all of your spouse's income is going to the nursing home. You don't get to keep any of it. Let's say your income is only $1,000 a month in Social Security. Then you can take $1,739 of income from your spouse in the nursing home and keep that. You're also allowed to keep or to use the spouse in the nursing home's income to pay health insurance premiums. So that's another deduction from the spouse's income. But other than that, one of the primary Medicaid rules that gets people into a lot of trouble is if you're in a facility, you got to pay your income or else they can legally kick you out. You gotta pay your income. It's called your monthly income obligation. And unless you're allowed to transfer it to a spouse or use it for health insurance premium, you gotta be paying a certain amount to that nursing home every month in order to keep your Medicaid benefits and to secure your placement in that home. So what if we're not married? What if we're talking about a single person, a person who's partnered but not legally married? What strategies do they have to protect money? One of the biggest issues I have with non-married people is that they have joint accounts. And Medicaid has the most, and you all are going to be really offended by this rule, they have the most obnoxious rule on joint accounts. If you are trying to get yourself on Medicaid and you have a joint account with someone else, let's say it's with your partner, or maybe it's with your daughter who you helped set the account up when she went to college, and all of the money in that account does not belong to you. You didn't put any money in there. Your loved one just put your name on there for convenience purposes, right? It's not really your money. Well, guess what Medicaid says? Oh yeah, it's your money. If you are trying to apply for Medicaid and your name is on an account with a lot of money, it's your money. And it's very hard to prove it's not. I did it once, and that was with a mother who had put her son on her account when he went to college, and he had, and I chastised him for this, he had $80,000 in a checking account, which no one should ever have. But at any rate, when we went to apply for Medicaid for mom, there's $80,000 sitting in a checking account with mom and son's name on it. And we had to produce bank accounts for 20 years to prove that only his employment income ever went into that account. And that way we did convince Medicaid that it didn't apply to mom. I don't like joint accounts. I don't even like joint accounts if you're married. Joint accounts are super dangerous when we're talking about Medicaid. What about joint assets? What about grandma's cottage in Wisconsin? I can't tell you how many times I've met with the client and they don't even tell me about grandma's cottage in Wisconsin because they don't think it's an asset. Like, why would this be an asset? It's grandma's cottage. Grandma's not alive anymore. The cottage is now owned by probably 10 people in the family, right? So nobody thinks this is an asset. It counts as an asset. So if the applicant's name is on grandma's cottage, if the applicant inherited 1/10 of this cottage, the applicant has an asset, which is going to count against them. What you can do is get all 9 other owners of grandma's cottage to say they're refusing to sell grandma's cottage. So if everyone signs a statement stating this is grandma's cottage, we have had it for 100 years, and no one is going to agree to it being sold, then Medicaid can't hold it against you. So some problems in being partnered and not legally married when we're looking for Medicaid is that there's no protection for the partner who's not married. They don't get to keep the house. They don't get to take $109,000. They're not entitled to any transfers. So if one partner has no money and the partner with money needs Medicaid, it's all got to go because there are no legal transfers between non-spouses. On the other hand, it can actually be good not to be married, because if the wealthy partner doesn't need Medicaid and the non-wealthy partner does, the wealthy partner gets to keep everything and doesn't even have to disclose, right? Have you heard of a crisis plan? Has anyone heard of a crisis Medicaid plan? So let me give you an example of a crisis Medicaid plan, which we frequently use when we've got an individual, a non-married person. A crisis plan is when a client calls me from the hospital and says, mom is going to a nursing home and she's never coming out. This last fall, this last problem it's insurmountable. We're never going to be able to bring her home again. She's got $200,000 and we don't want to spend it all on the nursing home. What legally can they do? If they are already in the hospital and they go to this nursing home, they can engage in what's called a crisis plan if proper legal documents are in place to begin with. But aside from that, what a crisis plan means is that you are making a gift of money during the 5-year look-back period acknowledging that you are breaking the law. You're breaking the law. You're not allowed to give money away 5 years before applying for Medicaid. You're acknowledging you're breaking the law and you are agreeing to pay the penalty. Okay? So, if you gave $200,000 away, you would have a $200,000 penalty. How does that work? It does not. What if you give $100,000 away? If you give $100,000 away, then you'll have a $100,000 penalty. So if we take the $200,000 and we split it in half, think of a loaf of bread. Take a loaf of bread, you split it in half, you give half of it away, you break the law, use the other half to pay the penalty the law imposes, which legally allows you to save half of the funds for the family while paying the penalty Medicaid will impose. Do not do this without an attorney. It requires the purchase of one of those annuities. It requires an irrevocable trust. It requires a whole lot of hoop jumping. But if it is necessary to do this, and one reason it is often necessary to do this is because we have an adult caregiver child who never got paid. So what if we've had an adult caregiver child, never got paid, has been taking care of mom for 10 years? You cannot just give all your money to that caregiver child. You can't do it. It would break the law. But a crisis plan where the family agrees, everyone could say, okay, we'll do a crisis plan. We will compensate that caregiver child for 10 years of labor with this $100,000 gift, and we will use the other $100,000 to pay off the penalty. And that is a good way of compensating a caregiver child. The best way to preserve funds for an individual is through a special needs trust. And we talked about this earlier. This is where if you just have $200,000 laying around, you don't qualify for Medicaid. But if you have $200,000 in a special needs trust, the Social Security Act says it counts as $0. And the policy behind that is the Social Security Act at least acknowledges that it's expensive to live with a disability. So if you are a disabled person, you have to be disabled to qualify. You are permitted to have more than $2,000 and still qualify for benefits because of the expense of being disabled. Here is the catch. And in my opinion, oops, I wasn't going to give my opinions, but in my opinion, it's a pretty fair one. And the catch is that if you put your own money into a special needs trust to qualify for benefits, then when you pass away, any money left in that special needs trust, if you leave any money in there, it goes back to the state. It goes back to the state to be used for Medicaid benefits for other future disabled people like you. So that's the catch with the special needs trust. I have a lot of people come to me with a disabled loved one in their life, and it is frequently a disabled sibling or a disabled adult child. Sometimes it's a disabled partner. And their biggest worry is, if I need care and I need to use my resources for care, I'm not able to care for my disabled loved one anymore. So who's going to care for them? What do I do? And it's a terrifying thought. It keeps them up at night. They are so terrified sitting in my office talking about this idea, just the idea of what will happen when my 60-year-old child with a developmental delay that originated at birth, he's never lived alone, he's never had a job, he's never been independent. Who's going to care for my child when I can't care for myself anymore? And the one saving grace of the Medicaid regulations is that it says you can transfer all of your resources and the house, literally everything you've got, to a disabled loved one and still qualify for Medicaid for yourself, even within the 5-year look-back period. So one of my first questions to people is, do we have anyone who is disabled in the family? Do we have anyone who needs to be taken care of? Because if we can transfer funds to provide for them, then if mom can no longer care for that person, we will have money to hire someone to care for them. we will have money to continue to support them in the house. One of the hardest results I see is when mom ends up going to a nursing home and it's too late to save money and the adult disabled child can't stay at home anymore. So he's lost his parent caregiver who he's been with for 60 years, and now he's got to move. And it's not easy. It's not easy at all to place a 60-year-old with a developmental delay at that stage. And it's traumatic. It's a really, really traumatic thing to have to do. So I love to be able to plan for that one in advance. Did I see a question over there?
I have one, but I can't.
Okay. What about caregivers? So a lot of people are caring for somebody they love who is running out of funds and may require Medicaid in the future. And Medicaid has extremely punitive rules on the treatment of caregivers. One of which is that if you are related to the person you're caring for by blood, or if you are friends with them, they don't define what friendship is, but if you're friends with the person you're caregiving for, or if you are related by blood, you are presumed to be doing it for free. There is a presumption that you are giving up your time, your time, your free time spent with family, time otherwise spent working. You're giving up all sorts of things, career advancements, salaries, promotions. You're giving up all sorts of things to take care of your loved one for free. That's Medicaid's rule. I think it's probably the harshest rule on the books, in my opinion, because what caregivers do in our country is worth, I think somebody said billions. There's billions of dollars in uncompensated caregiving going on in this country by people who are providing care for absolute free. I worry about my clients who are caregivers who aren't being compensated because it means they're not paying into the Social Security system. And they might not be accumulating enough credits to qualify for Social Security when they retire, or even if they do have enough credits, their Social Security payment is going to be negligible. It's going to be tiny because they've been out of the workforce caring for a parent, caring for a disabled loved one. So because of this really punitive rule, if you want to pay a friend or a family member to care for you, you have to use a contract. It's called a caregiver contract. And it basically says that I agree to care for you in exchange for fair market value. So you can't pay the person $1,000 an hour. You have to pay market rates for home care or whatever kind of care they're providing. So I typically recommend $35 an hour is the going rate for most things. $100, $150, sometimes $200 an hour is appropriate for more sophisticated caregiving. The contract has to be signed before payments are made. You cannot sign a contract and then retroactively pay your caregiver for 10 years of care, which I think is so horrible, because what if somebody spent 10 years caring for someone and they cannot be retroactively compensated for it? People don't know they need a contract in order to get paid. So it has to be contemporaneous. You got to sign the contract and then payments need to start going forward. You have to use an hourly rate. It can't just be a lump sum payment. You got to keep timesheets. So there is a little bit of work involved, but it is, in my opinion, a fair and equitable way. There's my opinion again, a fair and equitable way to compensate people who are caring for a loved one with a disability. You are also allowed to transfer your home to a caregiver child if that child has been caring for you and living with you for at least 2 years before you have to move to a facility. So if your daughter is living in your home caring for you for 2 years before you have to move to a facility, you are allowed to give her your home. There is no penalty, there's no payback. It's perfectly permissible. Medicaid considers it to be compensation for the care given. Now, you have to prove some stuff. You can't just claim you're living there. You got to legitimately be living there, and you have to show proof Bills are coming to that house in your name. Your driver's license is at that address. You've got to have a neighbor who's willing to, testify on an affidavit that you are legitimately living with your mother, and that it was for 2 contiguous years, not, 6 months here, 6 months there, a couple months here, no interruptions, 2 continuous years. And you were providing care that prevented you from going to a facility. So it's got to be the highest level of care. If mom's got dementia or Alzheimer's, that's considered prima facie evidence. Like, no one's arguing with that. If you've got a dementia diagnosis, it's just everyone's agreed that that means the person would otherwise have had to have gone to a facility if you were not in that home caring for them. So we have some problems. Can you both transfer your home to the caregiver and pay them under a contract? Anyone want to take a guess? That's probably the right answer. The jury is actually still out on that one. But that's what I tell people, because in my experience with Medicaid, I think it's highly unlikely they're going to feel charitable enough to say, yeah, it's fine for you to get compensated with both. So I advise my clients, pick one or the other. Either go for the house or go for just the caregiving fees. One or the other, don't do both. And here's a really hard one. Yes.
On the previous slide, it needs to be proven with a caregiver child that they presented an institutionalization. Does that include, what defines institutionalization? Is it hospital, rehab, or is it?
Skilled nursing facility. Yeah, skilled nursing facility. So if you can prove that, I think the law actually says that the care you provided has to be a skilled level of care. It needs to be equivalent to what a person would receive in a skilled nursing facility. So again, it's really fortunate if you have a dementia or Alzheimer's diagnosis, because that's just the proof right there. If you don't have that, then what you really need to prove is 24-hour supervision, right? You need to prove 24-hour supervision. You need to prove assistance with all activities of daily living. Here's something interesting, though, about that rule. And that is, though it requires that the caregiver child be providing that level of care, it also allows the caregiver child to hire someone else to do the work while they're at work. So you could actually be a caregiver child working 40 hours a week outside the home. And as long as you've got a caregiver replacing you in the home while you're gone, you're basically supervising, orchestrating, managing that care, right? You're still a caregiver child. So it's not like you are handcuffed to mom for 2 years. You can still work, you can still go places. You just have to prove that a skilled level of care is being provided in the home and that you're living there. A big problem for me is stepchildren and grandchildren and other relationships that aren't recognized. So if you've got a partner who's caring for you, they're not going to qualify for the home. If you've got a stepchild, they're not going to qualify. If you've got a grandchild, they're not going to qualify for the transfer of the home. The law literally says child, blood child or adopted child. So you either have to have been born to the person or you have to have been legally adopted by the person to qualify, which is really unfair. So in those cases, I recommend, if you're caring for someone and you're not going to be eligible to keep the home and you're living with them and whatnot, you need to seriously consider a caregiver contract or compensation through some other means, like legal documents, a power of attorney, or a trust. We have covered an enormous amount of material on Medicaid and asset protection. It's very complicated. I hope I've made it relatively simple for you. Does anybody have any questions?
I have a question about a disabled person. If you have somebody that has cerebral palsy, but they are able to work, are they still considered to be a disabled child?
It depends. Oh, so for disabled child criteria, you need to be disabled in accordance with Social Security's determination.
Well, she's received Social Security.
Yes, she is.
Decided she didn't want to do that and is now working.
I see. Okay.
So she's qualified, so is my grandson, both of them have cerebral palsy, and those are the people that I want to take out of my
Yeah.
stuff. But based on what you just said, I'm not sure.
I don't know that that will work. So here are a couple issues. So you can be on Social Security disability and still work. You just have to limit your hours so that you don't violate the rule about being unable to engage in substantial work activity. So sometimes you can be on disability and working and still qualify as a caregiver child. The problem here is that because there's no Social Security determination, you're going to have to get Medicaid to agree that they're disabled. And if they're working full time, I think it's highly unlikely that they're going to agree to a disability. Yeah, which is really, really unfortunate. Any other questions for me? Yes.
If I go to YouTube, am I going to look under the title Asset Protection and Medicaid Planning? And I will find it, or I'll find it somehow.
Find what? Find this? Find me?
Yes, this is being
Oh, live streamed.
live streamed, but is it like YouTube as well?
I hope so. I have no idea. You are
Yes,
beyond me.
on YouTube as well.
Okay,
So
it's
if you
gonna.
look up Elderworks, you'll be able to find these sessions.
Thank you so much.
Quoted here, Asset Protection and Medicaid Planning.
Look up the Elderworks stream for the session today. It's actually been a broadcast for this entire afternoon.
Thank you.
And I would encourage you, if you can find this presentation, review it, because there's lots of information on the slides. What I don't want anyone to do, and I'm glad you reminded me, is do not Google it, whatever you do. Don't Google Medicaid or asset protection, because what you will get is a million different varieties from a million different states, and these are specific to Illinois. So if you're going to look for information, make sure you are looking at Illinois information, or someone's going to send you way off track. Any other questions? So you can also, for those out there in the video world, you can also find us on YouTube on our own company website, www.duttonelderlaw.com. Yes.
What if you were deciding that you were going to let your parents come and move them into your home? Then what happens?
So then what you have done is you have taken an asset that would the question for people out there, again, in case you can't hear it, is what would happen if you sold your parents' home and then you brought them into your own home to care for them? What you will need is a caregiver contract, right? Because the only way to get compensated for caregiving is through payment from the proceeds of the sale of the home. But what you've done and what you need to give very careful consideration to is that you've sold an asset that Medicaid is going to count as exempt or not countable, and turned it into something they are going to count. So before you take major financial actions like that, you really do want to consider the consequences of converting a non-countable asset like real estate into cash, which is going to be countable. So that's got some really serious repercussions. One last tidbit I want to leave you all with before you go is it's very challenging to get into a good facility when you're already on Medicaid. So be very, very cautious in how you proceed with Medicaid and asset protection, because what's worth more than anything else is securing a good placement in a good facility and getting good care. And that can be very hard to do if you've already divested yourself of all assets. So all of us need to keep in mind that we have to keep some money available to pay for some amount of private pay so that we get good care. So with that, I will stick around for those of you who have any additional questions you want to ask me privately, but thank you all so much for attending.